Okay, let's talk about a task that happens in every single long-term care facility every day: taking vitals. It seems so basic, right? But the old school way of doing it, it comes with some massive hidden costs. So let's dive in and see what's really going on. So let me ask you this. What would you do if you knew that almost 1 in 5 of your patient records had a mistake in it? Because that's not a hypothetical. 18.75%, that's the documented error rate when people manually type in patient vitals. Just let that sink in. Nearly 1 out of every 5 entries could be wrong. And this isn't just about numbers on a screen. That crazy statistic connects directly to your most precious resource: your people, your staff. Every single minute they spend jotting down numbers, double-checking, and fixing typos, that's a minute they aren't spending with a resident who needs them. Which brings us to what we call the daily vitals grind. We're going to peel back the curtain and look at the real operational and financial drain that comes from this one seemingly simple routine task. Now, just look at this comparison. It's night and day. One study found it takes about 39 minutes to manually log vitals for 64 residents. But with an automated system, just 5 minutes for even more residents. You go from a process that's almost guaranteed to have errors and pull staff away from their real job to a zero-error process that lets them focus completely on care. It's a no-brainer. Okay, so we all agree the old way is inefficient and risky. So what's the fix? Well, that brings us to automation, a solution that was literally built to solve these exact problems. The solution is a system called VitalsSend for RPM from the provider EMA Telemed. And the idea behind it is brilliant in its simplicity. It just uses these FDA-cleared Bluetooth sensors to grab the vitals, and then poof, it sends them instantly and securely right into the resident's record in PointClickCare. No more typing, no more delays, and getting it done is as easy as 1, 2, 3. Seriously. Step 1. A caregiver uses a Bluetooth sensor to capture the vitals. Step 2. The numbers pop up instantly on a tablet for a quick review. Step 3. They tap a button and the data is transmitted. Done. Capture, review, transmit. That's the entire workflow. Now, this is where it gets really powerful, because this isn't just about making things faster or easier. Adopting this kind of tech can totally transform your facility's finances. We're talking about shifting this whole process from a cost center to a profit center. Let's start with the savings, because who doesn't like saving money? Just by getting rid of manual data entry, a typical facility can get back over 40 nursing hours every single month. I mean, what could your team do with an entire extra week of staff time? And as we all know, time is money. For a facility with around 44 beds, those saved hours can add up to about $14,700 in annual savings. That's real money going straight back to your bottom line just from fixing one broken process. Okay, saving money is great. We love that. But what if I told you this same exact technology could start generating brand new, predictable revenue from the work your staff is already doing anyway? Now that is a game changer. So how does this work? It's actually a really clever partnership model. Your staff performs the tasks needed for remote patient monitoring, that's RPM, and chronic care management, CCM. Then a physician partner bills Medicare Part B for those services. And here's the best part. The physician then pays your facility a fixed fee for the work your staff did. You bring in new money without ever having to deal with billing CMS yourself. And the requirements are pretty straightforward. For RPM, you just need to record vitals on at least 16 days out of the month and log 20 minutes of work. For CCM, you manage residents with 2 or more chronic conditions and, again, log 20 minutes. And get this, as long as you track the time for each program separately, you can actually bill for both in the same month for the same resident. That's how you really maximize the revenue. But look, this isn't all about the money, right? The ultimate goal, the reason we're all here, is to provide better care for our residents. So let's talk about how having this accurate, real-time data actually improves clinical outcomes. And hey, don't just take my word for it. The rest of the industry is catching on fast. Just a few years ago, about 60% of healthcare execs said they saw a positive return from RPM. Today, that number has skyrocketed to 90%. This isn't some futuristic experiment anymore. It's a proven, effective strategy. The clinical benefits are just huge.
I mean, first, you get a zero error rate, which immediately makes patients safer. One study even saw their 30-day readmissions for congestive heart failure drop all the way to zero. When you free up staff time, they can prevent problems before they become emergencies. And on top of all that, every reading creates a perfect digital audit trail for compliance. It's a win-win-win.
So you've got all this amazing data flowing in. You're saving time, you're improving care. How do you manage it all? How do you see the results in real time? Well, that's where this comes in, the central command center, called the VitalsFlow Dashboard. Think of this as your mission control. It's where you can track all the key metrics, like how much time and money you're saving. You can see trends, you can ensure accountability by seeing exactly who took vitals and when, and you can even use the data to spot care gaps or trace clinical events. It's all about giving you total visibility and control. So, let's recap. We've seen the problem with the old way. We've seen the automated solution, and we've seen the incredible financial and clinical benefits. It's pretty clear that the future of taking vitals is automated. The only real question left is, what's your next step?
And making a big change like this can feel a little daunting. But you don't have to go it alone. EMA Telemed provides really thorough training, and they have a support line staffed by actual people, not robots, to make sure your switch to this better way of working is totally smooth and successful.
So I'll leave you with this final thought. If one simple change in how you work can save you thousands of dollars, slash data entry errors, give hours back to your nurses, and open up a whole new revenue stream from work you're already doing, what's the real cost of sticking with the status quo? What is the cost of waiting?